Greetings. My name is Dr. Jack Einhaber, PhD. This is an overview for a partial but significant solution to worldwide healthcare flaws. I'm going to go through this quickly because there are subsequent videos which provide a lot more detail and will be very enlightening. And hopefully this will give you a general concept, but will entice you to visit the other videos. Okay, my proposed program offers higher quality medical care via enhanced prevention and a substantially reduced incidence of medical errors, some achieved by avoiding anchoring bias, which will be explained in subsequent videos, increased efficiency, lower healthcare costs via quicker, more accurate medical visits, accurate selection of necessary medical tests, with concurrent reduction of unnecessary tests. The increased efficiency and cost savings should make such safer, truly high-quality healthcare available to many more persons at a lower cost. Additionally, there's an opportunity to vastly expand our medical knowledge by new databases and match patients who suffer complex or rare ailments with highly specialized esoteric physicians whose expertise is not commonly known. I'm going to go right to a diagram behind me to illustrate the system. Okay, it's accurately called Comprehensive Solutions to Healthcare System Problems. What happens is a patient experiences symptoms. They plug these symptoms into a culturally oriented questionnaire, and there will be helplines and support staff to help people with this. The result will be filtered through a computerized database of our existing medical diagnostic knowledge. This will be cross-referenced with patients' individual medical records and pharmacy records. There's some exceptions, but this is for most of the patients. So it's very individualized. Then there will be a computer printout of the results, which will delineate possible causes of the symptoms, suggested tests, and/or treatments. And it will act as a guide for the doctor who has the discretion of accepting or acting on some or all of the computer's recommendations. The upshot is reduced visit time, reduction in medical errors, reduction in medical malpractice litigation. Let me swing around here. Okay, so the system acts as an advanced second opinion in a sense, and should be supported by all who want higher quality healthcare insurance. Doctors will feel more confident not to prescribe unnecessary tests. Insurance companies should also benefit because there should be fewer medical malpractice lawsuits because of the fewer errors. Okay, now, what the system will provide is a centralized, coordinated clearinghouse type of design or paradigm. And it would involve coordinating the various healthcare software programs that this system will provide. So it will alleviate a bunch of problems. Right now, the United States government requires electronic healthcare records. However, resistance comes because of the problems in transition. It's a very painful 6-month or so transition. Very difficult on staff and the physicians. It's expensive. The system also is conducive or susceptible to fraud of various natures. Besides, there is no guarantee that once the electronic healthcare records are in place, that the physician actually refers to them. There's also no guarantee that they will make proper use of them. Physicians can gloss through them just as quickly as they gloss through manual paper records now, and still miss important, crucial, life-saving aspects. Okay, now the system is not political and it's compatible with any healthcare system, including single-payer ones such as Canada's. It counters the distractions and human problems common to any business and those peculiar to medicine. Medicine has a bunch of unsung behind-the-scenes heroes, the chemists who make the drugs, the physicists who design the diagnostic machines, the engineers who build them, the computer programmers, etc. The subsequent videos will also give you references as to what goes on shockingly in healthcare behind the scenes. Some good references are Dr. Marcia Millman's The Unkindest Cut, Life in the Back Rooms of Medicine, and Dr. Jerome Groopman's How Doctors Think. It's also adaptable to curbing nursing home abuses and counters a lot of the objections to what would curb these abuses. Now, this came about, a lot of it, through my own medical history and hard-learned experience with applications from my own education, very fine education. I've spent about 1.5 years of my life in hospitals in various countries, in numerous states, in various cities. I was told 6 times that I was going to die in a very short period of time. I was dead on the table during a liver transplant for a very rare, non-contagious orphan illness. I can tell you that even the finest, most brilliant, most well-meaning, dedicated doctors are not consistent often in how they look at and interpret medical situations and what they come up with in terms of recommendations. Plus, there's a tremendous amount of inter or between doctor difference of opinion as well. I would also caution you very briefly that a lot of the popular doctors and some of the TV doctors are wonderful in a lot of ways, but there's a lot of encouragement to learn and become proactive or interact with the doctors based on your own knowledge. In order to do that, that's all very well and good, but in order to do that, you have to have a certain base level of knowledge, or the expression, a little bit of knowledge can be a dangerous thing, really applies to this. Now, I've got to give thanks here to a few sources. The transplant family that donated the liver to me. Without them, whoever you are, and I can't thank you enough, none of this would be possible. If this system helps anybody or helps a lot of people, it'll be through you. Now, my lovely girlfriend, my darling girlfriend, who offered me half of her liver and has provided so much support for me during my hard times. My family, my great family, which has also provided a great deal of support. And of course, the United States military and its allies, without which none of this would be possible. We would be living in a very harsh, oppressive world. And I just recently, I want to show you this, I'm proud of this. I just recently got a medal for completing 15 years as a transplant recipient. And I'm going to show you the other side, which is probably more important. It says donate life, so I want you to think of that. Please visit our subsequent videos for detail that will be very, very enlightening and important. Okay, thanks very much for listening.